How much running is too much? Hello, I'm Dr. Leon Popovitz. Welcome. Recently, there has been a study that was published in the British Journal of Bone and Joint that talks about what happens if you run more than your norm. If you start incrementally increasing the amount of running aggressively and quickly. And the conclusion was that if you do increase the amount of running that you do, then you are at risk of greater injury. Now, it may sound simple, a logical thing, but it really isn't, because there's always been a debate. If you do not have any pre-existing issues with your joints, then theoretically running potentially wouldn't do all that much damage. But if you already do have, say, cartilage damage in your knee or ligament issues with your ankle, such as instability or chondral lesions, cartilage lesions, then that running, that pounding, would potentially accelerate the progression of disease and deterioration of the joint. But if you don't have a pre-existing issue with your joint, theoretically the consensus has been it's probably not doing any major damage. This study looked at a lot of runners and accelerated the amount of running the runners did, and concluded that even if you increase the amount of distance just 10% more than you did even a month ago, you are at a higher risk of running injuries. Now, running injuries could be a full spectrum of things and related to multiple areas of your body. Ankles, knees, hips, so many things. So as you increase, it's concluded now, as you increase the amount of running that you do, that will increase your risk of injury, which inevitably will increase your risk of deterioration. That's a conclusion I'm making. And that really stems back to what I've talked about before, that you really want to preserve your joints for a long lifetime ahead. And we see so many people that love to run. There's a certain endorphin stimulation when you do a lot of running. It's an outstanding way to maintain your weight. It's just, runners are just a niche of athletes that are very unique and love to run and can get back to running. And sometimes if we say have to do a procedure for them or any type of surgical procedure for them, and we have to pause their running for, say, 2, 3, 4 months, they get antsy. They need to get out there. They need to run more. It's that stimulation that they receive from it, and it's very unique. And I admire it, quite frankly. I think it's fantastic. It's a certain level of being in shape that a lot of people strive for. But unfortunately, it's a lot of pounding on your body, particularly if you're running in the streets, particularly if you're running on the concrete. So what I get from this study, even though they didn't look at the actual degeneration of the joint, they didn't look at the cartilage itself, because that's really where is the key. That's the key, the cartilage, the lining of our bones, the articular cartilage. And you want to preserve that for as long as possible, forever. The tendons are, of course, important, and the ligaments are important, all those structures are important, but the cartilage is what preserves your joint. So what I gather from it, my conclusion from the study, is that if you get more and more active with your running, you continually increase your running on a steadily basis, and a particularly aggressively steady basis, a quick basis, a rapid basis, then you're going to get more injuries, and those injuries may potentially lead to degeneration. Now, that's a conclusion that the study still has not made, but I can't help but make that conclusion, quite frankly. And I'm not saying stop running. If you're a runner, you love to run, go for it. Enjoy your running. But be very cautious. Be careful of where you run, what the surface is. Be wary of your shoes. Avid runners know that. Make sure they don't wear down too fast. And be cautious of how much running you're doing. It's well known that it's really a matter of being active, being mobile. Just simply, if you're running for your cardiac health, for your well-being, for your longevity, you don't need to do a lot of running. You know, the 10,000 step concept works even if you're walking, even if you're walking rapidly. You don't actually need to do the running to get that longevity benefit, that cardiac benefit, that health benefit. But if you really enjoy the actual process of running, then I would highly recommend being cautious of how many miles you run, how many days per week you run, and in particular, based on this study, how rapidly you increase the amount of running you're doing. It's more and more important to understand that the preservation of your cartilage is most certainly the key to your life. Just like the preservation of your liver, just like the preservation of your kidneys, of your heart, of your lungs. We can, a lot of people like to smoke. They like to smoke a lot, but that's a big strain on your lungs. If you do it too much, eventually you're going to cause serious harm. A lot of people like to drink. If you do too much, your liver can't handle it. Try to think of it the same way with running. It's a pleasure. There's certain benefits to it, of course, but you don't need to overdo it to gain those benefits. I'm Dr. Leon Popovitz. Thank you so much for joining us.